You're welcome once more to House of Medicine, where we demystify the myths that surround medicine and give you facts about your health. Once more, I remain Dr. Khalifa Aye, and today I'm going to be discussing the fear of surgery. Quite a lot of people in our environment who develop surgical conditions are counseled about the need to have surgery to treat their illnesses. Some of such patients tend to decline consent for no other reason than for some fear of the outcome of the surgery. Oftentimes, this is because of poor knowledge, poor understanding of the situation, and the possible detrimental consequences of declining surgery. Why do people fear surgery in our environment? One of the very common reasons in this part of the world is finance. Some people fear that they cannot afford the fees for surgery. Inasmuch as this is a viable reason, and we do understand the socio-economic situation of certain patients in our country, but we must also understand one thing that needs to be understood is the fact that failure to have the surgery when they should have been done can result in far worse financial burden than the initial burden which had led to the decline of consent. Another reason why a lot of people tend to turn down surgery in this part of the world is the fear based on previous experience, either from friends, neighbors, families, and relatives. You know, in as much as one surgery somewhere may have turned out badly, it's not always the case in every situation. We have so many competent surgeons scattered around this part of the world who can actually treat you and give you very good outcomes. However, note that there are few cases of complication that follow surgery, and this can happen even with the best of hands anywhere in the world. A way of mitigating this is by getting the right information from the right sources. Understand your disease state, understand the consequences of not having surgery, and understand the possible outcomes following surgery. Ask questions. When you are with your doctor, get to know exactly what is going on and what he or she plans to do for you. Never shy away from understanding your disease state. And then, another good reason sometimes people tend to shy away from surgery, again, is the fact that they do not have adequate knowledge as regards to what happens if they do not have that surgery. And again, brings us back to adequate counseling. It's either they are not with the right hands in terms of not seeing the right person, the right doctor, or they themselves did not show interest in understanding their disease state, leaving the decision in the hands of the physician. So, with all this being said, one thing people must always avoid is seeking general information from the internet. Inasmuch as getting to know about your condition on your own is good, but without the professional guidance, there is a high chance of picking up the wrong information and understanding the wrong things and getting to become fearful or anxious for no reasons at all. Yes, the internet is your friend and has all the information you may require, but note that those information may either be right or they may be wrong. Not all of them are correct. And that is why you need professional advice and guidance to be able to do what is right. Also, get to understand that for you to get to have a good understanding of your disease state, you need to be with the right person. So seek to see the right specialist. There are various surgeons, surgical subspecialties. One surgeon cannot do all surgeries. Ask, confirm, and get to see the surgeon that fits your disease condition, and then you'll get a far better outcome. So thank you for being with us today on House of Medicine. I hope that subsequently your fear of surgery will be far less. Surgery is beautiful and gives very beautiful outcomes, gives improved quality of life, and keeps us all safe and healthy. So, as a urologist, it is our duty to make women happy by keeping the men healthy. We are here for everyone anyway. Do have a great day and see us in our next episodes. Bye.